speaker for today's session. It is my privilege to introduce Dr. Ram Prasad Pari, who will be delivering today's talk on medical imaging and deep learning applications. He is currently serving as assistant professor in the Department of Computer Science and Engineering at IIT Bhubaneswar and has an extensive background in machine learning, computer vision, autonomous robotics, and visual surveillance. He received both his BTech and PhD degree from NIT Rourkela, Odisha. Prior to joining IIT Bhubaneswar, he was an assistant professor for 3.5 years in the Department of Computer Science and Engineering at the Indian Institute of Information Technology, Design and Manufacturing, Kanchipuram. He has 5 years of cumulative industrial research experience with Samsung Research Institute, Delhi, and Siemens Technology and Services Private Limited, Bangalore. His research publications comprise international journals, conferences, and patents in these domains. He has also served as reviewer in many peer-reviewed international journals and conferences. We are truly honored to have such an eminent expert with us today to share valuable insights and experiences that will undoubtedly enrich our understanding and enhance our teaching and research practices. I request all to join me in extending a warm welcome to Dr. Ram Prasad Padi and inviting him to deliver his talk in this session. Sir, please. Over to sir.
Yeah. So thank you, ma'am, for such a nice introduction. And without wasting much of your time, let me share my screen and let us start the presentation. Okay. So I hope my screen is visible. Is my screen visible? Can anyone just confirm it?
Yes, sir, it is visible.
Okay. So yeah. So in today's topic, we are going to see what is medical imaging and how this deep learning that we are currently hearing from everywhere, how it is actually helping this domain of medical imaging. So actually, we will not go into the details of deep learning and all. We will see how this deep learning architecture that we are generally listening, like this convolutional neural networks, recurrent neural networks, graph neural networks, attentions, right? How they are actually helping in the field of medical imaging. Okay, so we will see what. How this problem was previously solved, then how this deep learning actually has revolutionized. Okay, then we will also see about like what are the challenges and future directions in these areas. So if you see the medical imaging, right? So medical imaging is a technology which actually enables where you can visualize the internal body structures without any invasive technology, right? So you don't have to insert anything, rather just imaging technology, like you think about X-rays when the pneumonia detection and all, when we take the X-rays, or for some other tasks, the CT scans, MRI images, right? So in those cases, you don't have to you use any invasive techniques, but rather you use non-invasive techniques like this imaging technologies, and from there on you try to gain some insights, right? So that is what is medical imaging is about. And there we, as I already told, we use different imaging modalities like this magnetic resonance image, which is a MRI, then computed tomography, which is CT, and then X-ray images. Even ultrasound images are one kind of imaging technology which is non-invasive. Then when you go to the applications, then you will see that medical imaging supports anomaly detection. Like let's say some body structure, internal body structure is not following the exact structure that should be followed. Then you have to find out what kind of anomaly is there. Like this, there is some tumor or something. Then disease staging, like in case of cancer, you need to have like what is the stage of the cancer by checking what is the size and all those things. Then treatment planning, how you plan like, different kinds of let's say some disease is there, how you plan to actually tackle it, right? So applications in diagnosis, this is very huge, right? Actually, when you go into medical imaging, it's not like I'm saying when you use this medical imaging to actually gain insight, it is for the doctors, right? So always doctor is the final authority who can actually diagnose you, not directly this medical diagnosis, but it can act as a add-on to the doctors, which can give very insightful information to them, so that their decision making becomes much more better. And there are challenges, of course, the challenges in data analysis, because the extensive volume and complexity of medical imaging data pose significant analytic challenges, right? So when you are thinking about normal image like this, images that we see, the color images are different from the images that are used for medical imaging, like this CT, X-rays, or MRI. You would have seen those images, right? Just a normal person, when you see these MRI images or X-ray images, you can't know anything. We need actually an expert to find out whether there is an anomaly or not, right? So now, age we need, like, we can't directly, as a layman, we can't directly infer any information. Similarly, it becomes much more complex for the computer system to do that, because the computer system also need to know what are the anomalies and all. So this is a very complex task. Also, the sheer volume of the images that we get out of this medical imaging is very, very high. Like, now the question is how to process all of those, right? So that is a very big task. Of course, innovations are there, like advanced methods like this deep learning have actually developed to enhance the interpretation of medical images. Previously, there were different methods that we were using, but nowadays this deep learning has in some way revolutionized this technique of medical imaging, and we will see how that is being done nowadays. Now, if you go to, like, as I told you, deep learning is a new technique. If you see, before 2015, people were not using that much, right? Now it is if you go to any medical analysis or healthcare, you will see that deep learning is being used. So now the question is, what were the people using previously? What were the traditional methods, right? So if you go to the traditional methods, people were generally using, like, for medical image analysis, the doctors used to see the slides, and from there on, they will um, infer something. So the experts can only tell that. So that was the traditional way of doing it. But there were some methods like feature engineering, where some machine learning techniques, if you see, like, not very far, but near past, if only before 2015, you can think of, like, from 2010 to 2015. At that time, when deep learning was just gaining its popularity, different machine learning techniques like this feature engineering and all were used to actually do that. Like, traditional methods generally relied on handcrafted features, okay, created by experts. Of course, the experts like this, the machine learning experts, they used to come up with different traditional approaches, and those were actually used. Also, this approach limits them in capturing subtle image patterns. Okay, there were, as you know, deep learning is performing better than traditional machine learning approaches when the data set is very, very high, right? So this the traditional machine learning approaches actually was limiting the capturing subtle image patterns. Okay, there are very minute image patterns are there, then those details were not actually being captured using this traditional handcrafted features. Also, sensitive to noise in medical images. There is so much of noise that you will get in medical images. High dimensional in medical images naturally contain noise and variability. Okay, it's not like the we see these RGB images. We will not get those kind of images in medical images. Actually, there are like multiple dimensional, right? The MRI images are very complex structure, having so many. When I say dimensions, means dimension of the data, right? So that is very, very huge, and it is just not possible for the traditional methods to actually capture those variability. Traditional techniques are particularly sensitive to these factors. Then challenges with diverse imaging modalities, like traditional methods often struggle with the scalability across various imaging types, right? So you have CT scan images, you have X-ray images, you have MRI images. So different types of imaging techniques are there. So for traditional techniques to come up with a technique that can work across all the modalities was a very difficult task. But nowadays we are having different techniques, deep learning techniques that can work on variable of or various of image modalities and can give you better results, right? So that was again one of the big challenges. Of course, the impact of diagnostic accuracy, because of all these challenges that I already discussed, all these three challenges, accuracy will go down. And in case of medical imaging, that is a very important task, right? For example, let's say we think about a case when some cancer is there, and let's say this some traditional method, it says that no cancer is there. That is a big, so it's like a false false negative is a big. False negative means it is falsely saying that it's negative. the cancer is there, but it is saying that it's not there. That false negative is a very big problem in case of medical imaging, because some person who is having cancer and say that it's he or she is not having cancer is going to create a whole lot of issue, right? But even false positive, and then it's no cancer and says that it's cancer, of course it will create some mental pressure for the patient, but at the same time the further techniques will actually tell that there is no cancer. So that is still, I couldn't say that false positive is a issue, but when you think about false negative, that's a big issue, and that is very important in case of this medical imaging, and that's why this diagnostic accuracy plays a very important role. Then increase clinical workload, because the efficiency of traditional approaches lead to more effort required by clinicians, right? So just as I told you, the accuracy was not enough, so it creates unnecessary pressure on the doctor or the expert to come up with an inference. For example, like this false negative I told, let's say something is saying some your model or the then say that, let's say your model is saying that it is not cancerous, but the doctor feels that it is cancerous. So you see there is a difference in opinion, right? So that is a big problem. So it creates unnecessary clinical workload, right? So this actually underscores the need of data-driven adaptive methods like deep learning. Okay, so introduction to then what is deep learning then for a medical image analysis? So importance of medical imaging in healthcare. Medical imaging is essential for visualizing internal structure that I already told. Now, how this deep learning has helped? So deep learning techniques have transformed medical imaging by significantly enhancing the diagnostic accuracy and streamlining the clinical workflows. So when you are thinking about deep learning techniques, they are actually automated approaches. You don't have to come up with any traditional handcrafted features. Okay, when I say handcrafted features, like you would have learned about different machine learning approaches, right, by now, because machine learning is so popular nowadays. So some way or the other you would have listened about, you would have studied about different machine learning approaches, right? So if you see the traditional machine learning approaches minus deep learning, you will see that they are generally mathematical approaches. You will see that to complete statistical methods will be proposed, and from there on we need to see whether some data point belongs to some class or not, right? So those approaches actually require so much of mathematical understanding, as well as coming up with features that can actually help you to say whether some disease is there or not, for example, right? But in case of deep learning, you just need a whole bunch of data, and from there on there's different approaches in deep learning that we are going to see, like this fully connected neural networks or convolutional neural networks or recurrent neural networks. They will actually learn by themselves, right? So deep learning algorithms automatically actually extract the features and representations from complex imaging data, thereby reducing the interpretation time and improving patient outcomes. So if you compare the deep learning applications with the traditional approaches, you will see that there is a whole lot of difference in accuracies and all. And then adaptability of deep learning in clinical settings. The versatility of deep learning allows its applications across diverse clinical environments. Okay, whether it is like I told, in traditional approaches, you need to come up with different handcrafted features for different kinds of modalities. But deep learning approaches can work on all the modalities at a time and can give you good accuracy. Of course, the challenges are there, because as I told you, deep learning is still a evolving area. So much research is going on. If you see the deep learning applications that were there in medical imaging in 2015, it is changed now. People are using so many, like there is an architecture that you are going to discuss, like UNet architecture, that was very famous because of this imaging applications and all, which was not there before 2015. But nowadays, even new methods like this language models have come now, how we can actually connect this medical imaging, deep learning, and then language approaches, right? So all collaboratively, how it can go, that is the biggest challenge over here. As I told you, this convolutional neural networks or recurrent neural networks actually have revolutionized this approach of image analysis using deep learning. Then automatic future learning, that also I explained. Deep learning models uncover complex patterns and high-level representations that are inaccessible to traditional algorithms. Then, of course, performance enhancement is one of the outcomes, we can say. Deep learning has significantly improved that, whether it is like false negative or false positive or total accuracy, whatever, or we call different machine learning accuracies, like this precision recall, F1 score has improved a lot. Then adaptability across imaging modalities also there, that I already explained. Then impact on medical image interpretation. If you see, deep learning empowers advancements in medical image analysis, allowing for insights into subtle abnormalities and optimizing diagnostic process. Okay, so that is the final outcome, I would say. Like deep learning, if you see in general, have been very powerful if you compare with the traditional approaches. That is the gist of this slide. Now, different deep learning architectures, if you see that, of course, you would have learned about convolutional neural network architectures. I have not included the fully connected neural networks over here because generally when it comes to imaging, the convolutional neural networks works far better than the traditional fully connected neural networks. Actually, the fully connected neural networks were designed for data of multidimensional data, that is correct. But when it comes to images, this convolutional neural network actually works well on image kind of data, right? So actually, if you see the history of convolutional neural network, it is actually based on how our what do you say, how our visual system has what do you say, visual system works, right? So if you see the starting of convolutional networks, they have actually tried it on a cat, how a cat actually perceives from his or her eyes, right? So from there on, how this data actually passes through different neurons and then it processes. That's how this convolutional network was designed. So the basis of convolutional networks is on how our human visual system works, right? So that's why when it comes to imaging, generally the convolutional neural network is the go-to way, right? So that's why, how does it work? It extracts spatial features in images, right? So then it can do actually classification, segmentation, detection. We are going to see what are these tasks in medical imaging in general. Then there is recurrent neural networks also, right? So designed for temporal and sequential data analysis, like if you have sequence of data like ECG signals and all, right? So then how can you process that? So that is where the recurrent neural networks come into picture. Then there are customized models in deep learning, like this attention mechanisms or transformer mechanisms. Then there is graph neural networks and all, right? So there are different techniques. So most generally, if you see the literature in this area of medical image analysis, you will see that convolutional neural networks is the go-to way to actually process the medical imaging. Now, if you compare with traditional with this is goes without saying. I don't need to go through this slide because you see, as I told you, traditional methods, if you see, lots of feature engineering was required. Okay, so if you compare with accuracy, it is too high. So at the end, it is not even helpful when you go with traditional approaches. But with deep learning approaches, the what do you say, the feature engineering is very low because you just have to see how the data is and how to pre-process the data. Once you pre-process the data, then it all comes down to how you actually apply different deep learning architectures. And those who are not from the domain of computer science, that from them also it's not a big deal because there are whole lot of deep learning architectures for medical imaging nowadays are there. So for the beginner purpose, we just have to come up with a data set and then process the data to see how these different deep learning architectures work. Okay, so but for a computer scientist researchers, I would say that there is whole lot of research, like how to bring different modalities into picture, how different I will come to that term when it comes to modality. Then there is like how actually bring these language models nowadays to picture. So research is too much, even if you are from the domain of computer science or even if you are from the domain of other areas, still so much of research that lies over there. Now, what makes this CNNs actually powerful for spatial data? Because CNNs excel in analyzing spatial data by applying different layers like convolution, pooling, and then there is activation and all. Okay, so that those things we are going to see a little bit how actually applies, but these are very powerful concepts which actually drives the notion of a convolutional neural network. So this convolution, pooling, and all those parameters actually allows to capture the hierarchical image features. Okay, so from layer by layer. So in the first layer, it will learn some features. Then in the second layer, those features will actually concatenated together to move toward the higher layer. Still, actually, you get the outcomes, right? So that is why it is a hierarchical feature that comes into picture in case of convolutional networks, and that plays a very important role. Then this UNet also I explained, right? So UNet is a very powerful tool, powerful architecture that was proposed by a famous researcher Runberger at the year in the year of 2015. And UNet architecture, I am going to show you after one or two slides, was very powerful. Actually, is very powerful It's a systematic design which includes a contracting path for context gathering and then an expansive path. So you will see that two paths are there. It's like a U. From one of the paths, actually the features will be learned, then the other path, actually the feature will be concatenated with the previous features to actually move it forward. So it is like a U structure that you are going to get. Sometimes we call them as encoder and decoder structure. So encoder is the where the encoder is the path where actually the architecture learns different features. Then decoder is the path where different features are concatenated together. Then they are their spatial size is actually increased, right? So that actually forms a U kind of architecture, and this plays a very important role in case of image analysis. Okay, more specifically in the area of image segmentation. Okay, medical image segmentation, I would say. If you see the medical imaging unit is effective for tasks such as tumor and organ segmentation. So that is what I was saying, the segmentation, right? So unit is effective for tasks such as tumor and organ segmentation. Let's say you are having the CT scan images, right, or MRI images. From there you want to actually know where some tumor is there or where is some organ is there, right? So this unit kind of architecture actually can give you the actual outline of that organ or of that tumor. That is very important, because to know, so when you will get the data, so much of information is there. From there actually to know where the tumor is a very important task. So that can actually, it can, this kind of architecture, unit kind of architecture actually can segment that portion for you and can give you that segment where you can actually focus on. Okay, so instead of focusing on the whole image, you can just focus on some specific part, whether that portion is tumor, right? So you think about a doctor, right, who is an expert, who want to know by checking the whole image whether there is an issue or not. And to him actually this kind of deep learning architecture can actually give you a position where the tumor could be. Do you see, so much of hard work can be reduced, right? So because the doctor can now just focus on that part. Of course he has to focus on other parts to see whether there are other anomalies which the imaging technique didn't capture, right? But that is a small task, one, because there he doesn't have to focus that much, but he has to focus only on the part where the tumor is there. So that is why application of unit in medical imaging is very, very huge. Okay, when we are going to see how that looks. If you see broader uses of CNN in healthcare, then CNNs are used for detecting lesions and then classifying abnormalities in imaging modalities, right? So applications extend to chest X-rays, retinal vessel segmentation, brain tumor delineation, all those things. Then impact on clinical outcomes is also there. See, the use of convolutional neural networks has led to improved clinical decision making, as I was explaining, right? For a doctor, it becomes as an add-on, right? It becomes very easy for him to focus on the actual part where some issue is there or what some abnormality is there. Now, if you see the architectures, it is multi-learnings in CNNs, multi-layer learning that happens. As I told you, hierarchical feature learning happens. So convolutional neural networks employ multi-layers of convolution and pooling, right? So you'll see that convolution, pooling, then activation. Okay, so there is some concept called as activation. I'm not going into details of that because deep learning, we are not focusing on deep learning as a whole, right? We are just focusing on what are the different deep learning applications that can be done in medical imaging. So I will just give you a small hint like how these convolutional neural networks are there. So you will see. So I think I have an image over here. So if you see this image, you will see that there is a image that is passed, and then from there on, you actually pass a convolution filter. Now that convolution filter actually moves from left to right to till the end. Okay, so you can think of like a filter is like a small square area. So let's say your image size is W cross H, where W being the width and W being the width and H being the height. On that, you will actually think about a square area like 3 cross 3 pixel. Okay, so that 3 cross 3 window will move from left to right, and then once it comes to the end, then again it will come down and then it will move again. Okay, so that way it will cover the whole image. So you can think of like this convolution kernel moves, and then from there on actually we will generate 1 pixel for the output. Okay, again how that is done and all, I will not go into details of that, but you can just think of like a convolution kernel. Actually it's applied on some part of the image, and then some part of the image where you have pixel values that will be multiplied with this convolution kernel weights, and then you are going to get some pixel, right? So you see, from an input image you can actually generate an output image like this, right, which is almost of the exact size as the input image. I would not say the exact size, but because the size will be reduced, of course there are different parameters like what would be the step or stride that you are taking, what would be the padding that you actually give to the image. Okay, so based on that actually you can get almost exact size as the input image. Again, there are other concepts like pooling and all which can actually help you to reduce the size. Okay, so that is the whole concept of convolutional neural networks, and this is just for one layer, I would say. This is you can think of like convolutional neural network is a hierarchical structure. In the first layer, this is what happens. Then in the second layer, then these kind of this becomes an input to the next layer, right? And that goes on for some of the layers, right? So in that case, what happens? This is a hierarchy. All the features from of the previous layers actually are being used by the next layer, right? So that creates a hierarchy. So simple features are, you can think of like at the beginning, let's say you are giving an color image. At the beginning, these edges will be detected, then those edges will be actually concatenated or connected together to form some shapes. Then those shapes will be connected together to do some detection, and from there on you can actually interpret the data, semantic data you can actually interpret. So that's why these convolutional networks are a very powerful tool, right? So multi-layer learning that happens in convolutional networks. Then, as I already explained, the significance of UNet. So UNet also is a architecture which is purely based on convolutional networks. Then function of UNet contracting path. So there are two paths, as I told you. One is this encoder path and decoder path. So in the encoder path, actually it learns the features. Then in the decoder path, these features are being concatenated together to actually generate a what can I say, higher dimensional output, I would say. Because generally, if you see these convolutional networks, you will see that the image size or the feature size decreases, right, as it goes on. Because as I told you, you are going to use this pooling kind of structure, which actually decreases the size. Now, the question is, if the image of size W plus H and you get a very small output at the end, then it would be very difficult for the doctor or an expert to know, right? So that means there would be some way to actually upsample the image. Like this pooling can actually downsample the feature resolution. There should be some way to actually upsample the image resolution, right? So that is where this decoder structure comes, where you have to use some reverse convolution or deconvolution, generally we tell, right? Or transpose convolution also. Some literature books, some books you will find out, right? So those, the transpose convolution will actually increase the spatial resolution of feature maps, and that way the output that comes is almost the same size of the input image, right? Okay, other applications, if you see in image segmentation, you will see that brain tumor segmentation is one of the very important tasks. From brain, how you will actually segment the tumor data. Okay, so CNNs are utilized for brain tumor segmentation using MRI scans. Okay, so generally the brain tumor segmentation works on MRI data, aiding in precise neurosurgical planning and management. Then retinal vessel analysis. Okay, from the retina, different vessels are there. How we can actually analyze that data? So CNNs assist in segmentation of retinal vessels in fundus images, improving the ophthalmological diagnostics in care. Okay, so there are some concepts called as fundus images. We are not going into details of that, but from there on, actually, we can find out different retinal vessels, and that is a very important role, because there are different eye diseases like this glaucoma or let's say cataract and all that can be detected very easily with this kind of retinal vessel analysis. Then chest X-ray classification, of course, this is a very important task. You would have learned about this during this COVID, where pneumonia was occurring, and how this chest X-rays can actually help you to detect this kind of pneumonia. Even CT scan images that are very important in this case, right? So CNNs contribute to the classification of chest X-rays for identifying various pathologies, supporting early detection and diagnosis. Okay, so this is a non-invasive technique, so you don't have to actually invest something or insert something into the body just to take, like you would have taken, I think, some time or the other in our whole life, we would have done some X-ray, right? So there you see just some light comes. Of course, when you think about X-ray images or radiology in general, they are harmful to the body, so we don't do it on regular basis. But again, whenever needed, we are doing it, right? So you just get a flash of light, and then you get the X-ray images. And those I'm talking about, those images can directly be used to actually do some analysis, right? So you see how easy it is nowadays. Yeah, this is the unit architecture that I was talking about. So you see, then an input image, then you apply the convolution block. Let's say you are talking, I will not explain all of this because I will just say that this is a convolution block. Okay. So in convolution block, let's say you are giving an image of size 572 cross 572. Then let's say you are getting an output of 568 cross 568. So that is what I was saying. So after applying a convolution block, the size could be almost the same size of whatever the input was, right? So from there on, again, you have to use some pooling technique to reduce the size, and then again you can apply the convolution. Then this process goes on, and you see, as I am telling that you are applying some pooling. You see this down arrow is the pooling, so that means you are applying a pooling over there. So only the convolution is not decreasing the size. Convolution, as I told you, can decrease the size by a little bit because of the stride and all those, right? But it will not decrease the size by much. But at the same time, this pooling can actually, what it can do, like this, there are two kinds of pooling that we generally use, this average pooling and max pool. They can actually preserve the data because you will take a small section, and from there on you will actually pool the data either by averaging the pixels or by taking the maximum of some of the pixels, right? So by doing that, you are actually preserving the data. At the same time, the size is reduced, right? So reduction in size is also very helpful, because if you keep on applying convolution and the size doesn't reduce much, then the layers in convolution neural network would be very big, and those kind of neural networks are very difficult to train even the size of the neural network or the depth of the neural network is very high, right? So in those cases, the pooling plays a very important role by, say, reducing the size, and slowly you will see that from this the second convolution block the size is reduced, then again the second convolution block some size is reduced, then it goes on till some size, let's say 30 cross 30. From there on, you see that if you keep on decreasing, of course it will decrease, but the researchers would have, like this paper, the author of this paper, they would have found that there is no what do you say, performance gain by actually going down the route, right? So from there on, what did they do? They actually make it one dimensional, because till now we were going two dimensional as an image 30 cross 30. From there on, they make it one dimensional, and you can think of, like, from there on it is like the exact opposite of whatever is done. So that is the most important thing. Till that time, actually what people were doing, they were actually giving an input image, and we were stopping over here where we were doing some classification or regression task. But the most important thing over here is that from here on, actually it will try to increase the size. Okay, that way only you can get a image which is all like some reasonable size, where you can actually visualize what is happening, right? So that is very important. So that is why you have to use some way to actually increase the resolution. So that is where the reverse convolution or up convolution or transpose convolution that comes into picture, which is exact opposite of convolution. So instead of decreasing the size, it will actually increase the resolution of feature maps. So you will see that slowly the feature map resolution will increase, and the researchers have proposed a nice way, because the increase in resolution is as such, it is same as in the encoders. So you see here, this is of size, you can think of like 512 cross 64 cross 64. So you will get almost the same size, so that we can actually concatenate these two, okay, because of the same resolution. Similarly, it will keep on going. Even for this layer, it will be so you see copy and crop. That means you will copy and crop the exact size that is there. Okay, as I told you, this will not generate exactly the same size as this one, but near about that size. So what you have to do, you have to bring it on, then you have to copy and crop. That means you will bring it, crop it, and then concatenate. Similarly, this will happen for this layer, this layer. So at the end, you are going to get a feature map of, or the output map of almost the same size. I would not say exact same size, because this is 572 cross 572, but when you see this is just 388 cross 388, right? So it is not even almost same size, but of reasonable size, where the doctor can actually see whether there is any area which is abnormal, right? So this is a very important architecture, because you apply it to any segmentation task, not only I would say medical imaging, but you apply it to any task that is segmentation task, you will see that this kind of architectures work very well. Okay, then that is convolutional neural networks, and you can remember this, and even you can after this talk, you can actually see this unit architecture and try to see how these kind of architectures can actually be used for like image segmentation. Then there is recurrent neural networks in medical imaging. So it recurrent neural networks, as the name suggests, recurrent, right? So the data from previous data will be used in the future, right? So that is what is meant by recurrent. So it's like a recursion. So functions of recurrent neural networks in sequential data analysis. So we have seen like recurrent neural networks are generally used in sequential data, like the textual data, right? So recurrent neural networks are specialized in analyzing sequential data types, which includes time series medical signals. Okay, for example, this what do you say, this ECG kind of signal. So in a ECG, generally you get time series data where you go or get all these graphs, what happens for each time, right? So functions of RNs in sequential data like this ECG imaging, right? So LSTM networks in temporal dependencies, there is a what you can say, there is a subfield of recurrent neural networks, which is long short-term memory, which is very important neural network, which actually excel at capturing the temporal dependencies in dynamic medical data, right? So then deep recurrent neural networks models and ECG interpretation is very easy because of this deep neural networks and RNNs. Then cardiovascular analysis also, it is very important. Then impact of RNNs on medical imaging. If you see the ability of recurrent neural networks to process temporal medical image and signal data highlights their transformative role in medical diagnosis. Right. So the whole gist of this slide is recurrent neural network is also one of the deep learning architecture which plays a very important role for time series data like this ECG data. So this is the structure of recurrent neural networks, where you can think of like these are the time series information. So in X1 timestamp, you got some info, X2 timestamp, you got some info, X3 timestamp, you got some info, Xn timestamp, you got some info. So like a you can think of like you got the graph time versus the your ECG data, right? So you can think of like for each time you get some data, right? So that data will be taken as an input, and whatever the output that you are getting, that is okay. But again, you see the this hidden layer of this first block is actually as an input to the next layer. Again, you give the data from this layer. So you see, this is not going in one direction. Rather, you are giving the data at current timestamp, as well as you are getting the output from the previous timestamp. Right. So that is why it is a recurrent neural network, and it goes on till the last layer. Sometimes we can actually predict from directly from the last layer. Sometimes you need to take prediction at each layer, and then you find out some output, right? So that is why these are known as recurrent neural networks in general. Coming to medical imaging, generally recurrent neural networks directly can't be, it can be used, but mostly you will see that they are generally passed through convolutional networks like this breast cancer. I've shown you one of the images for breast cancer detection. Generally, the images, as I told you, in general, they work very well with the convolutional neural networks. Okay, or I can rephrase it. Convolutional neural networks actually work very well with image data, because this convolutional network is actually made for this processing these images. Okay, so that's why directly passing an image to a RNN doesn't make any sense, right? Even though you can pass it and you can see, but that will not give that much of good accuracy and all. So generally what people do, they pass this medical image to a CNN network, and once you pass to a CNN network, as I told you in my one of the slides with this uh, unit, you see, once you pass an input image through a CNN network, generally you will get a feature of lower dimension, right? So without passing, of course, the up convolution blocks. So without passing up convolution blocks, generally you will get a feature of lower size, right? So now that lower feature size, or you can think of like lower dimensional features, can actually be passed through different recurrent neural networks, and you can get insights out of it. Okay, you can think of like you can get a series of data out of these convolutional networks or features of different timestamps. Then you can actually pass that, because that is very important, because time series, when it comes to recurrent neural networks, it works on timestamp data or time series data. That is very important. Right. Then there are, of course, new architecture like this attention mechanism and graph neural networks are there. Okay, so attention mechanisms are integrated into the convolutional networks, enabling selective focus on significant image regions, which improves performance in tasks such as pathology detection and anomaly identification. So the whole point is that in 2017, actually, there came a paper which is known as "Attention is All You Need." That is a very important paper because that is the paper which tells that up till before that, actually, people were using convolutional networks from right to left for everything, right? But this paper told that actually instead of focusing on the whole image, you can just focus on the right portion of the image, that attention part, right? You have to give attention to some specific part, right? So that is where this attention mechanisms comes into picture. And those who are very much interested, they can actually go through that paper, "Attention is All You Need," which is a very important paper. And there, instead of actually focusing on the whole image, a medical image, you can actually focus on some tumor data. Again, how that is done and all, that is the area of research in the domain of attention. Okay, so we'll not go into details of that, but what you can do, you can actually go through this attention mechanism and see how this works in medical imaging. Then there are graph neural networks where you actually what you can do, you can model complex rational data derived from they derived from anatomical or functional imaging, effectively capturing the spatial and contextual dependencies. Okay, so the whole point is that you can actually represent your data in a graph structure, and from there on, there is a concept called as graph neural network, which can be actually applied to get data modeling. Okay, now, of course, there is, as I am giving you examples like different radiology, like this X-ray, CT scans. So applications in radiology, if you see the deep learning applications in radiology, so one of the very important tasks is detection, like detecting whether a tumor is there or not, then classifying whether that tumor is, let's say, benign or malignant, right? Whether it is harmful or not. When I say benign means harmful, sorry, when I say malignant means harmful, when I say benign means non-harmful, right? So that is very important. That kind of classification is very important. So this deep learning actually has revolutionized this radiology with deep learning. Deep learning has enabled the automation of detection and classification in chest X-ray imaging. I already told. Then the convolutional networks also plays a very important role. Then it facilitation in of early diagnosis through automation. Okay, so you can actually diagnose early. Then classification to optimize clinical workflow, that is also very important because CNNs can actually assist the categorical classification of chest X-rays, whether there is any pneumonia. Let's say you are talking about a pneumonia classification, you can actually find out whether there is any pneumonia or not. Even you can think about like lung cancer, right? So in case of lung cancer, also you get the chest X-rays or CT scans by which you want to know whether there is any abnormalities there or not, right? So this is what you can actually do with what do you say, radiology. So you can see when you get some CT scan data, generally we do some pre-processing. Even some kind of reconstruction on images is done. Whether let's say some data is absent, so we can actually extrapolate the data. We can create those reconstruction. Of course, that is not a uh, deep learning technique, but rather it is generally a imaging technique too. When I say imaging technique, means software imaging technique, which can actually reconstruct a good image for you. Then from there on, actually denoising and quality enhancement is done, because this kind of images could be very noisy, containing lots of irrelevant data, and those can actually be removed to get a clean image out of it. Again, no deep learning over here. Then comes the organ segmentation. You see, let's say you want only this portion of the data, okay, left side of the brain, then actually that can be done by this kind of unit architecture where this organ is segmented, right? Now from there on, let's say this lesion detection, like where the abnormalities happened, the exact area, you see, that can be detected. So you can see there are two things that we are doing. One is the segmentation task, which involves this deep learning architecture, like this encoder decoder architecture. Then comes the detection part, where you detect which area of that segmented part is abnormal, right? Now once you detect that part, then there comes the part whether it is actually harmful or not, right? So malignant means harmful, benign means it's not harmful for the body, right? So to know that whether the lesion is a benign or not, that is a classification task. So you see, these are the three very important tasks that happens in case of medical imaging, not only on radiology, but in any medical imaging. You will see that these are the three important tasks. One is this segmentation, then detection, then classification. Okay, then it could be like this is very there are different stages of abnormality, right? Or you think about like cancers in general, right? So there are different stages, which stage it is. Now, based on that, actually, that monitoring is required. Okay, maybe time to time you have to do this, and you have to monitor whether the size is increasing or not, whether this is harmful or not, like that, right? And from there on, actually, you can come up with a time series data, and that can actually be passed through a recurrent neural network. That can also be done. You see, at this time, this is the size, then other size, other time, this is the size. Okay, when I say size means it could be directly the data, right? Not only just the volume or something like that. So that can actually come up with a time series data, which can actually can be used in RNNs, right? So this is the whole workflow of any medical imaging, or in general when you think about radiology images, right? But here, as I told you, most important thing is three tasks: the segmentation, then detection, and classification. Okay, so this plays a very important role. You think about any cancer diagnosis, you will find out this kind of subtopics. Yeah, so this also I already explained. In the interest of time, I will just skip it. Okay, so these are the different tasks. As I told you, this classification you can do, then segmentation you can do, even you can analyze language analysis. Like, I think this is very important now. Nowadays, even when I do some, let's say, pathology testing, what I generally do is that before actually going to the doctor, of course, you should not do that, but we are very curious to know. So sometimes what we do, we pass it through the GPT to see whether there is an issue or not, right? So how does it do it? It's actually, you have lots of data. From there on, actually it tries to gather the information from that textual data and tries to generate a report for you, a concise report for you, which can actually tell you some information, right? Of course, I as a researcher in this field, I will not, what do you say? I will not tell you to actually do that. I will never advise you to do that. But that is the even sometimes I heard that there was a article when a doctor was doing that. But again, that is very risky. Doctors should not actually do that. But we can say that, like AJ researchers, when we are writing nowadays research papers and all, we are also taking help from GPT to know what is this area and all those things. So of course, doctors can use this kind of techniques to actually get better understanding. We could not say that GPT is not helpful, but again, they can use it for better understanding. That is one of the things. So there is no harmful in that, but only by processing that data. If a doctor gives you some medicine, then that is very dangerous, because this is about health. We should not take the risk. Right? So that kind of report generation is very easy. But even not only just pathological report or something, you can directly even pass the image data. From there on, actually you can use this tools to actually generate the report directly out of it, right? So these are the very, so previously people used to do these kind of techniques where they used to do classification or segmentation, like that, right? But nowadays, this report generation and language analysis is a very important task. So that is where this language models come into picture. Okay, so that is why currently this vision language models, like you have large language models, this vision language models actually plays a very important role, where this image data along with the textual data is processed together, right? So that is very important. Right. So this I already explained, like in cancer, segmentation plays a very important role. So I did not go into details of that. Okay, so this is one of the breast cancer detection tasks, where you get the slides, right? So on these slides, this you get the tissues, right? So tissue slides, then those will be uh, divided into two parts, whether tumor is there or not, or like, then generally there is two kind of processes that we have, right? Training and testing. So training a deep learning model, actually you need to annotate that data, whether there is any tumor is there or not, right? So that kind of annotation supervision is done by the doctor. Then it is passed through different deep learning architectures to come up with a probability whether there is any cancer or not, right? So then that model is used on the test data, where you actually give a sample for which you don't know whether there is any cancer or not, and that is where it is passed through this deep learning model to actually get the output out of it, right? So that is what is the one of the tasks that we do. Breast cancer detection is a very important topic. Again, we can do these similar things on different data sets, like multi-cancer data set, different kinds of cancers, right? So on this, generally the technique remains the same. You do some data pre-processing, then you do some segmentation. From there on, you extract some features, then you pass through a deep learning architecture to classify whether there is any abnormality is there or not, right? So it can be like a multi-cancer data set, means it could be having any data, right? So generally for all the kind of this kind of cancer detection techniques, generally we use the same methodology. Some data pre-processing, then segmentation, then feature extraction, then it passes through a classifier to tell you whether there is any abnormalities there or not. Now, deep learning in histopathological image analysis, I already explained when you have pathological reports, right? So the role of deep learning in histopathological analysis. So these convolutional networks have been essential in analyzing the stained histopathological slides for cancer diagnosis. I already told when you get these slides and how to process that, right? So in the, I need to be a little bit fast now. Even deep learning in computer aided design is very important, because computer aided diagnosis or CAD system employ deep learning to assist pathologists, right? So this system reduce diagnostic errors and this inter-observer variability. Okay, so by doing that, you can actually develop different CAD models by which you can actually analyze the different body parts, and that is where also this deep learning is widely used. So what it does is that it gives assistance in interpreting the complex images, right? So deep learning powered CAD systems assist pathologists by interpreting complex histopathological images. They highlight critical features that may be overlooked, right? If a doctor says that it can be overlooked, but when it passes through a CAD design system which can generate a 3D structure like that, then becomes very helpful. CAD system reduce inter-observer variability, I already explained. Then enhanced accuracy in cancer detection and grading. Of course, because of this CAD system, you can actually get enhanced accuracy. Then, then facilitation of clinical decision making. Of course, that would be decision making would be very much helpful. Okay, so these slides are not that much important. Let me go to some of the important slides. Okay, the challenges. So challenges in deep learning for medical image, if you see, of course, the scarcity of annotated data set is a very important point, because let's say you have a data set and you do not do the annotation. The annotation plays a very important role. If you do not annotate the data, then you can't use the deep learning technique. Most deep learning techniques, because deep learning techniques mostly work on supervised learning. Mostly, I'm saying there are some techniques which are unsupervised and semi-supervised. So such scarcity of annotated, although the data set is huge, but annotated data set is very difficult, because not any researcher can annotate the data. You need a medical expert actually to do that, like the doctors or the people who are actually working in the medical domain. They can only annotate the data, and that becomes very uh, difficult part, because they have their own task to come up with images and annotate that data is very difficult part, right? So that's why scarcity of annotated data set is a very important problem. Then model interpretability issues. So deep learning models in medical image analysis often function as black boxes, making the decision making process difficult to interpret, right? So even though you get some result, then you should tell why you are getting that kind of result, and that is like a very general problem in deep learning. It is worked as a black box, right? Then sensitivity to adversarial attacks. Deep learning models are susceptible to adversarial attacks, where im- imperceptible changes to inputs can actually lead to erroneous outputs, posing risk like potential misdiagnosis. Like I told you, if this kind of false negatives come into pictures, where let's say some attack has happened, where someone has erroneously put some data like that, so that is a very big problem. Okay, limited generalization capability. As I told you, we can work on different modalities of the data, but the same model, but still it is a big issue. It's not like always a single model can work on different modalities. So generalization problem is there. Also, one model working on, let's say, breast cancer diagnosis might not work for brain cancer or some other lung cancer, right? So that is kind of generalization is a big problem. So that is where the research lies. Then importance of collaborative approaches. Addressing these challenges requires collaborative approach, like the academia as research as well as medical research. They need to come together to actually come up with some good technique, right? So that kind of collaboration is a big problem, because we as an academicians, we need to actually go to the doctors and them, then the doctors need to give their data, right? That there is again this problem of whether the data can be shared or not, that kind of policy, right? So there are very big problems. I have tried to contact some of the doctors for some of the works, and currently I am working with one of the doctors from SCB, but believe me, it's a very huge task to actually get collaboration in these domains. Advances in training and explainable AI. Again, this is the second point, like how to explain whatever has happened, whether that is correct or not. That explainable part is very important, right? So those things only I have mentioned over here in my slides. So in details, I don't want to go in details of this because I need to move now. I have some other meeting lined up. Okay. So yeah, future directions, if you see, of course, the advancement in transfer learning and domain adaptation, like from one domain, how we can actually bring it to the domain of medical imaging and use them, right? Because this vision language models and everything are very popular now in other domains. Now, how to bring that actually into medical domain is a very important task. Then integrative multimodal approaches, like how we can actually pass different kinds of images like MRI, CT scan, PET images, pathological images, everything at a time and process them. That multimodality, and how when the data modality becomes more, then the model becomes very complex. Then how to process those kind of models. Then novel architectural developments in deep learning. We need to come up with new architectures which can work on different medical images. Then explainable AI already explained, like how we can explain whatever is happening, why it is happening, right? So that is very important, right? Okay, so this is, even the graph neural networks is a concept which is used widely by the researchers nowadays, right? Okay, so these are the things that I have put over here. So what we saw? So we saw that we have slowly moved into deep learning architectures, which is like from traditional approaches to deep learning architecture. Then we saw how the challenges are there in impacting the adaptation into different multimodal data. Then collaborative advancement and promise, how do we collaborate with the different people to actually come up with, when I say different people, means this people in the domain of medical and doctors, right? So how to collaborate with them to actually come up with the different models that can work on different indigenous data. Because let's say you are working on some data set that is based on United States. When you bring it to Indian kind of environment, it might not work well because we have our own genes, so we have our own history, right? So that kind of setting might not work. But the question is how we can actually bring those kind of models to our domain and work it, make it work, right? So that kind of transfer learning is also very important, right? Yeah. So yeah, I'm getting calls for now the other meeting. Okay, so with this, I will conclude my talk. Okay, so I have another meeting which I need to join. Yeah. So yeah, ma'am, am I audible? Yes.
Very good.
Yes, ma'am.
Participants, if, is there any question related to deep learning and image application, you can write it down immediately on the chat box.
So
Because
as a task I can tell that you can look into this unit architecture in detail, right? So that unit architecture is very important. So from there on, you will see that very lots and lots of papers where this unit architecture is being used to actually do the segmentation task and all. Okay, so that is where I can tell you that you can use that time to actually work on that. Yeah. Yeah, so there is a question like, could you please explain why which deep learning architecture like CNNs, GANs, or transformers are most effective for medical imaging? I would say nowadays this transformers are very much important. Even CNNs has not lost their charm. Even CNNs are being used. So GANs are generally they are used for generating. Even let's say you do not have that much of data and you want to generate some synthetic data, then the GANs can play a very important role. But nowadays, these transformers and scanners play a very important role. Then, which model in deep learning is more accuracy in medical imaging? This is very difficult to answer because directly I can't say that there is just one model which can work on all kind of different different healthcare data or imaging data. There are different models which work on different kinds of data, right? So that is where I told you one of the problems is the generalization, right? So to work on different kinds of application to get up with to come up with a model which can work on different kinds of data, right? So that is the research, I would say. Auto encoders is also possible in transfer learning. Auto encoders, again, that is a generative model. I have not seen people use in medical image analysis in general.
Thank you for your valuable insights related to limitations of traditional medical images, deep learning in medical image analysis, and its versatility. Thank you, sir. Thank you so much.
So
Yeah, thank you.
so
So
much, sir.
yeah, I have a meeting now, so I need to move fast.
Thank you so much. You have given your valuable time. Though we know that you have busy schedule, but still you have given some time to us. Thank you so
Yes,
much, sir.
thank you, thank you.
Participants, you can take 15 minutes breaks. After 15 minutes, again we will rejoin. Ma'am, is this okay now? Ma'am, am I audible?
Am I audible?
Yes, ma'am. Yes, ma'am, you are audible.
Okay, thank you.
Okay, ma'am. Over to Simati Ma'am.
Good evening, everyone. Sorry for the delay because of technical glitch. I, Simatika Rai, Assistant Professor, Department of MCA, Trident Academy of Technology, welcome you all to the second session. We are truly honored to have with us Dr. Tripti Swarnakar, Professor, Department of Computer Applications, NIT Raipur, who is going to enlighten us with her valuable insights on the topic remote monitoring and IoT in healthcare systems. Dr. Tripti Swarnakar received the PhD degree in Computer Science and Engineering from IIT Kharagpur, West Bengal, India. She is currently working as professor and head in the Department of Computer Applications, National Institute of Technology, Raipur. She has served in different positions at Shiksha O Anusandhan deemed to be University, Bhubaneswar, Odisha, as Faculty of Engineering and Technology from October 1999 to February 2024. At present, she has more than 25 years of teaching experience in the field of computer science and engineering. She is currently guiding 6 PhD scholars. 10 have already been awarded. Dr. Swarnakar's principal research interest is machine learning, omics data analysis, and medical image analysis. Her aspiration is to work at the interface of these different fields or multidisciplinary environment. She is an IEEE senior member and IEEE EMBS and GRSS member. She is the founder chair for IEEE Bhubaneswar subsection WIE Affinity Group. She has organized many conferences as well as workshops successfully and chaired the Women in Imaging session for most prestigious conference in the field of medical imaging IEEE ISBI 2022. She is the founder chair of International Conference on Ambient Intelligence in Healthcare, technically sponsored by IEEE, and is one of the core team members of IEEE Returning Mother Conference since 2023. She was also a principal investigator of multidisciplinary project on validation of artificial intelligence based models in screening and diagnosis of diseases in routine clinical practices sponsored by Intel India for the year 2018 to 2021. Now, I would like to hand over the session to Dr. Tripti Swarnakar. Ma'am, please.
Thank you, ma'am, for your wonderful introduction. And my pleasure to share the things with you all. So let me just share my screen. Is my screen visible to all of you? Is the screen visible, ma'am? Okay. And is it now?
Yes, ma'am, it is visible.
Okay, fine. Thank you. So, very good evening to all of you. I have been already introduced to you people. And yes, it's really I enjoy working in a multidisciplinary environment. And as it was being introduced, that I basically work with the medical domain people. So today we will have a discussion on revolutionizing the healthcare, the role of IoT in enhancing efficiency and outcomes. Because nowadays almost all of us are wearing some smart devices through which our data are being collected. And the most important part of any human life is the healthcare. Okay, so let us talk about it, that how IoT, Internet of Things, can enhance the healthcare sector, and let us explore it. So just as you all are aware, but just to have a flow, let us first introduce what is IoT, Internet of Things. So when we talk about Internet of Things, it is nothing but it is a network of interconnected devices that can collect the data, that can exchange the data among themselves, and they can act on the data. Those type of interconnected devices basically comes under the Internet of. So these devices communicate with each other and with central system over the internet, enabling automated processes and enhanced decisions. So you can just see that each device is able to collect data, and in each device normally to some extent some type of processing are being done. But yes, for a complicated process, we need a centralized system where they communicate their data, and after the processing, the output can be fed back to these devices. Okay, so IoT has permitted many applications, including agriculture, industrial IoT, and healthcare system, that is IOMT. That is the presence of internet on medical. Okay, IOMT. We call it IOMT. So components of IoT. Yes, as I told, there are multiple devices, so and we need some connections between these devices. So let us see what are the different components. When we talk about IoT, not only collecting the data, it is also an exchange of data and to act on data. Acting on data can only be done if you have analyzed the data which you have collected and come to some type of result. Then that is what is basically act on the data. So definitely for all these three major components, for three main work of IoT, are different components. The first very important component is a device which we call sensors that gathers data from the environment or system, such as it can be temperature, humidity, or motions, or many other things are there. Then that's the role of the sensors, which help us to gather the data. Devices, yes, they are the hardware because these sensors has to be put somewhere. So it's a hardware that performs specific functions such as smart thermostats, wearable health monitors, or connected appliances. So we need certain hardwares where these sensors can be put over. Okay, so that device is very important component of IoT. Now, as we want to analyze the data which we have collected through these two components, devices having the sensor, we need some type of software which can analyze on those. So applications and platforms that process and analyze data, providing insights and control capability. So basically, my team work on the software side. I do not work a lot on the sensors and all those part, device part. So first, when you collect data from different medias, data has got their own nature. So when we talk about analyzing those data, a lot of prior homework has to be done to make that data usable for the machine learning model or usable for analyzing it. So what we call the pre-processing. Okay. So my team basically works on the software part, that is applications and platforms that process and analyze data, providing insights and control capability. And last but not least, very important thing, that is data networks. So as it is the interconnection of multiple devices, a central system, place where the data will be stored, the place where the analysis has to be done. So we need a network. We need an infrastructure that facilitates communication between devices and systems, including internet connections and cloud services. That is the reason, it's not only the computer science people who are talking about IoT. It's the electrical people, electronics people, they are also talking. Even the mechanical people are talking. Yes, because the sensors part, normally, we as a software engineers, we do not focus a lot on that. We do not understand a deeper concept when it comes to that type of devices. The device part also, although we work, but definitely we require the expertise from different domains, like from electrical, from electronics, because when it comes to the data networks, the electronics people, the communication engineers comes into the picture. Because if the communication is not done timely, whatever good the software we have developed for analyzing those data, it will be time consuming. So each components, even like if the data network is very good, but if the software what we have provided for analysis is not optimal, then also the processing will take time. So each component has got its own research field. Few people love to work on sensors, few people work on devices, few people work on softwares, and few works on the data networks. You should be very clear that which particular, because each component has got its own challenges. Okay, so you can see in the pictures also, there are the things or devices, and the data are being some gateways, the communication gateways, the data are connected into the cloud. Then the analytics is being done at some place, and then it goes to the user interface. So there is a complete process is going. So research can be done on any of these components. Okay. Similar type of picture over here also is the interaction between the three components of the Internet of Things. So first is basically things with network sensor. This is the data stores are there. One has got its own like challenge, and this is your analytics engine. So after doing this one, you go back over here. Okay, and this whole connection, the dotted lines is nothing but it is your data networks. So next comes why we need this IoT. in healthcare? What motivated us that let us use this particular IoT in the field of healthcare? So what was the requirement? First was enhanced patient care. That is of utmost important. Nowadays, almost like in the previous days, we had a joint family. Okay. If someone is going out for work, it's always there someone else is at home to attend the elderly people, the small child who are dependent. But nowadays, when we are talking about nuclear family, it has got its own advantages and disadvantages. And we know the necessity is the mother of invention. Yes, when these concepts came into the picture, we required something else, because that is one of a very important aspect of our life, that when some elderly person or a small child is at home, we want to have a proper care, because anyhow we are working for our family. Okay, so this was a basic requirement why we wanted something that even when we are not at home, something should be there which can help us to monitor. So, like enhanced patient care, IoT enabled continuous monitoring of patient health, wearable devices, and connected sensors, allowing for early detection of issues and personalized treatment plans. Yes. So, if and see another major thing is coming in picture is mm, the patients now dying with heart attack. Previously, it was being told that elderly have the heart attack. Now that young mass is having it. So something wrong is happening in our daily uh, things. And although we are so much of health conscious, we are not able to continuously monitor where the things are going wrong. So, in certain situations, and specifically in the patients where continuous monitoring is very much required, we require such type of things, because it's not possible that a person can be in continuous connection with the patient. Doctor cannot stay for the whole day for so many of years or the patient. Even if we are taking a person who takes care about our elderly people, as a human being, there are certain requirements. For some time, they will be living. Maybe in that sometimes something will happen. So what we want is, we want a continuous monitoring of patients. Okay, through wearable devices and connected sensors, allowing for early detection of issues and personalized treatment plans. Second very important thing is streamlined operations. Automated systems and real-time data collection optimize hospital workflow, improve resource management, and reduce as administrative burden. See, uh, it is like, although we say that if everything is being done manually, automation is not there, we can make more people employable. But managing that more people itself becomes a headache. It's an administrative burden. It is being always told, when we are less in number, maybe the management becomes much better. So there should be an optimal number of human intervention. We cannot totally remove the human intervention. Am I audible? Am I audible?
Yes, ma'am, you are right. Yes, ma'am.
Okay. Is it now audible? Okay. So the streamlined operations, that is automated systems and real-time data collection, it optimizes the hospital workflows. Okay. And third very important thing, as I told, optimal having the human resource and all those things is good, it is manageable. But when it increases too much, now it becomes very difficult to manage the human resource. So cost reduction, efficient monitoring and data analysis lead to timely intervention, because when it is human intervention is too high, if the proper things are not communicated timely and proper things doesn't get communicated, then it may be the service to the patient may not be given timely and a proper treatment may not be given. A lot of things are there which basically thought of like, yes, certain things need the automation. Efficient monitoring and data analysis lead to timely interventions, reducing hospital readmission and unnecessary treatments, ultimately lowering overall healthcare cost. Because in a hospital, if you will see big hospital, why did it cost? Is it the medicine cost has increased? No. The type of facilities they provide in the patient is they add all those factors. The doctors think whatever services they are providing, because their payment of all these people has to come out from there. And many of you might be working in the private universities. Why the fees is high? So obvious thing, the facilities which are being provided, it has to come out from that fee. Okay, so what we require is we want this data to turn into the action. Okay, so for what we required something what we call the IOM. So IoT is defined in the traditional healthcare system as communication between medical devices that are connected to the internet and share patient data such as text, images, and videos. It is a real-time process that reduces the time required for diagnosis and treatment. IoT devices communicate with cloud platforms such as Amazon Web Services, where captured data is stored and analyzed. Why do we require the cloud platform? The storage device as well as the compute device, that is self cost. So through this cloud edge technology, we are trying to reduce that whole cost so that finally the burden should not go to the patient. Because even if you are giving a very good treatment, but with a very heavy cost, the general public cannot get that. Our whole objective, as I was being introduced, that I was one of the PI for the Intel project. In that project, we validated the AI models being developed by Philips and once IIT Madras-based startup that was a Credible Health in the some hospital setup. That if we are able to give a good result with the AI models being designed by these two companies, what compute system we required, what infrastructure is required, how without disturbing the normal treatment process of the some hospital, without putting a cost on the patient or maybe a minimal cost on the patient, how a better treatment can be given. So that was the project which I did with Intel and these two companies. That was the Philips, which is a well-known for healthcare devices. And another was the Credible Health, which was an excellent work, and that was an excellent exposure for me. Closely work with the hospital setup, with the patient as well as the doctors together. So it's a real-time process. So IoT devices communicates with cloud platforms. So now when we are communicating, we are collecting the data. Now what we need is some analytical tool. There comes into the picture AI and machine learning to make sound decisions using the IoT. So that is the analysis part. The motivation is IoT is defined to address the gap in the traditional healthcare system. Okay, so this from my side, if I see the left one is a traditional healthcare system, and right side is basically IoT enabled one. You can just see there the doctor is there, pharmacist is there, patient is there, one to one they are interacting. It's not that the work is not being done, but that is basically consuming time. So there is a gap. To overcome that gap, there should be a connection between all. So they are the four corners. We wanted to connect them. So there comes into the picture, that is your internet of, okay. So interconnection of several smart devices, ingestible and monitoring sensors, enable short range and long range wireless networks, helps in early diagnosis of disease, machine learning and artificial intelligence technique. Because the analysis, till now we have collected the data, we have communicated those data, we have developed the devices, but we need now the some analytical tool, and there comes into the picture the AI and machine learning. So manage huge amount of patient data using the cloud and fog computing. That's what I told. See, as we are collecting data from the different one, the compute system may be quite heavy and it will be very costly. So to overcome that, normally now we use the cloud and the fog computing for the data as well as the compute both may be 100% or maybe partially. So there also in the project which I did, few things locally we did it in some hospital. There was a compute system, and few things was being computed from the cloud in the Intel office Bangalore, and then we got the results over here. So that was the setup it was being made. Applications of IoT in healthcare, a lot of applications are there, and this is one of the picture which is being done in Australia. It is being used in one of the hospital setup. Just a minute. Just a minute. One phone is coming. Okay. So applications of IoT in healthcare, remote patient monitoring. That is the basic reason why we required this one. So what it requires devices like smartwatches and fitness trackers that monitors vital signs like heart rate, blood pressure, and glucose levels. What is the benefit? Continuous monitoring allows for early detection of health issues, reducing emergency room visits and hospitalization. Yes, because when we shift the people, that also is a time consuming. So certain things there itself, certain initial treatment can be done, and the patient can be at least brought to the level that they can be moved to the hospital. So that much time at least we will be able to get if we are doing the remote patient monitoring. Smart medical devices, IoT enabled insulin pumps, because when we are manually giving the insulins, sometimes the patient doesn't know what is the proper dose, what is the proper time. They neglect those things. So that is one of the very good development which has been done. IoT enabled insulin pumps are there. Pacemakers has been designed and infusion pumps are there. What is the functionality of that? Devices that can adjust treatment in real time based on collected data, providing personalized care. This is a very important fact. As a patient, sometimes because lack of knowledge is there, we do not understand. There is a practice and we continue that one. So, but a doctor, and that is the reason if we are taking continuously some medicines, doctor asks report after 1 month, report after 1 week or something like that. So that particular thing can be to some extent reduced, because from the rural areas coming to the urban tertiary care, that itself is a time consuming. It is not only taking the time, it is also basically because in the rural setups, most of the people are daily wages people. So if they take off from their work, they are losing that day money. So, and we also know that even if we are in a college and a working day, you have to go to the hospital. It is the whole day. It goes. So a lot of time gets consumed when we are moving ourselves to that particular one. So if something can be smartly handled in a remote way, we will be saving our time. We will be saving our money also. Okay. So telemedicine and virtual care. Integration is IoT devices that supports telehealth consultation, providing remote diagnosis and treatment. This is now has become, at least for few diseases, this has become a part of our life. What is the impact of that? Expands access to healthcare, especially in rural or undeserved areas. Okay, see, like in Bangalore, like city, moving from one place to another is really a very tough job. By that time, a person health condition may further deteriorate. So certain things are very much required in current scenario. So hospital and facility management, smart infrastructures. In the hospital management itself, we can have the IoT systems that manage lighting, heating, and cooling for energy efficiency. Just yesterday, I was in Hyderabad in one of the conference, and the host institute, I was very happy to see. It was a private one, that they automated the complete lighting system of their washrooms. So as soon as you will peek through the door, it's not going to, it's all lights are off. But little bit, if you will open the door, outside lights gets on. Once you will go completely inside, all the washroom gets on. So see, that is very much required in a big infrastructure. You cannot keep a person always that who can switch on or switch off the lights, ACs, fans, and all those things. So there you need something like that. It assess tracking devices that tracks equipment locations and uses, ensuring better resource management and reducing loss. Okay, so these are very important things. Chronic disease management, devices and apps, tools for monitoring chronic conditions like asthma or diabetes. Because this is something which require that immediately you should give something, offering real-time insights and management recommendations. Okay, so asthma is something a person will be very normal. Suddenly, asthmatic attack will come, and you can just see what extreme case can be. Because I am having this problem, so I do understand to some extent that what is the problem when such type of things are there. People will feel that this person is doing natak, but it's not like that. It is a sudden attack comes. Okay, so outcome is improved disease management through timely giving the treatment. So the next is the data collections. Yes, data sources such as smart object, health monitoring devices, and mobile apps that are integrated with sensors such as infrared sensors, medical sensors. So these are the different devices which are available in the market. Human body connected different variables and incitable sensors to collect data such as pulse rate, glucose levels, and oxygen levels, which is not now all of our smartwatch is having this particular thing. Next very important thing now comes is the network model. Okay, because we are collecting the data from the different sources, it has to be shifted to some places. So sensors must be connected to the gateway via networks that communicate and store data either locally or centrally. Okay. So there can be two ways when we talk about this one. It can be through some gateway. You can just see the below one. Or it can be through the body area sensor networks, such as Zigbee, Bluetooth, and ultra wide bands or local area networks such as Ethernet and Wi-Fi can be used. So they need to be, we need some network model. Okay. If any doubt, you can just stop me. Another is body area sensor network. So this is a very specific, and people are doing a lot of research in this field also. Body area sensor network is made up of sensors that are placed all over the human body. Medical super sensors have recently entered the market. Okay. And if you can see the picture, they are all these round. So they all are the sensors being fit on the different parts of the body. And each sensor is collecting the different data. Like here it is pulse, oximeter, motion, temperature, ECG, EEG, heart rate, okay, accelerometer, EMG, pressure. So everything has to go to one point, that is sync at a point, which is connected with your the data collection part, the access part, the network. Fine. So it is made up of sensors that are placed all over human body, medical super sensors. Just a minute. The remote thing is advantages also, disadvantages also. Because when you are physically present, there is no interruption. But definitely when it is a distance presence of mind also, certain phones I'm not able to avoid. Okay, fine. So this is your, so what we are doing over here is, if you can just see, at one place, all the data are getting synced. It is being this Sutram device. It is being access points, and it is being sent to the connected people. Okay. So that has more memory and better processing and communication capabilities than standard sensor nodes. So that is the advantage of your body area sensor networks. The remote health monitoring system mainly consists of a portable patient monitoring unit, PPMU, at the patient's home, mainly consists of sensors and electronic circuits. So normally if a very serious patient is there or who really need a continuous monitoring, a small setup, which we call a portable patient monitoring unit, is being set over there. And as I told, certain computations, certain advice are locally being done, and something which needs the intervention of doctors and other caregivers, the things are being passed and the decisions are being taken. Okay. So this is the concept of body area sensor network. What are the different gateways? Because as I told, the communication plays a very important role. Where gateway is playing a very important role. So there can be radio frequency identification, Bluetooths are there, Zigbee is there, near field communication, wireless fidelity, satellite. So see, as a electronics people basically do the research on this part of the IoT. They mainly focus over here, okay? And as a computer science people, normally we focus on the analytical part. So this is a small comparison made between Bluetooth and Zigbee. So these are protocol stacks. So it is your 250 kb. This is less than 32 kb. Range is 10 to 100 meter, whereas this is your 30 to 100 meters. Link rate, then battery, whether it is, this is rechargeable, this is non-rechargeable devices. So this is the different comparisons, and this is where basically the communication engineers, they work a lot. So although I am having a rough idea, but deeper knowledge on this part, normally I haven't explored it. So data storage layer, yes. People work on this one also as a computer science IT people. The data being stored and analyzed in this layer using the cloud-based computing, which is centralized, but it's also adaptable and scalable. Okay. The decentralized computing techniques like fog and edge for more privacy of the data. So the people's working on the security, cloud computing, they are talking about this. So you can just take from each part, each component, a lot of research can be done, taking a specific interest area. So another decentralized computing is blockchain technology. Fine. So which are the new boom things which as a computer science people now we are talking about, whether it is a fog, edge, or blockchain technology, we are talking about these things. And IoT is basically using these as one of the components. Next comes the service layer. Okay. The application layer uses AI and deep machine learning to understand data and to monitor trends and changes in the collected data. That is the analysis part. Okay, because unless and until you have done the analysis, you can't give any advice to the patients for whom you are collecting those data. Okay, so there comes the main work of ours where we do the analysis using the AI and machine learning. Okay. So predict the accuracy of medical data using the sophisticated machine learning algorithms. Discuss the security and privacy of the patient data while transmitting over the network. So you can just see on the larger side of the pyramid, the main thing is patient and data, which is in the raw form. Here you has, because the analysis, when we are talking about the analysis, you have to understand your data. So here comes patient and IMT, where the information thing comes, that is your structured and unstructured form data are there. In order to gain the knowledge, what has to be done? Expert in machine learning algorithms need to be done. Then, as a domain expert, doctors have to give an insight on the analyzed data. As a machine learning people, as a computer science people, as an engineering technology people, we can do the analysis, we can show the results, but before taking the action, the domain experts have to give the insight. After they have done it, then the actions will be taken. Okay, so you can just see how the pyramid is going narrow. Okay, so this is what is the final consequence of all these things? It improves the efficiency of patient monitoring system using the contiguous patient records. Very important thing, and specifically when it comes to the healthcare, security is of at par the highest importance. This itself is now one of the research field. Okay, the security is required each level of IOMT data model. Like as I told that when I was working with the Intel project, you know, although directly we collected the data from the patient, but we took care that the details, certain details of the patient should not be revealed. Okay, so that is something a very ethical thing, and when you work on the medical domain, you have to take the clearance for that what data you are going to collect. You have to take the patient consent. Are you ready to reveal this much of data? If the patient says yes, then only you can. So a lot of thing happens when you basically go from a research to the real implementation of those type of medical things, whether it is an AI model or whether it is a device. The countermeasures have been taken place to thought from attacks like data unauthorized access, breaching, falsifications, and so there can be a denial of services, data protections, user protection, device protection. They all comes under the different types of securities. Okay, when we talk about data protection, it is data confidentiality, data integrity, message authentication, that whatever data we have collected, it is really authenticate, data availability. Each of them can be a big research area. When we talk about the system level protections, it is the user protection and another is the device protection. So when it comes to the user protection, it is like privacy of the user has to be maintained. User authentication has to be done. Okay. Then when it is a device protection, it is basically system integrity, system authentication, and systems availability. So these all things plays a very important role when we talk about the IOMT security. Now, what are the advantages? IOMT have many advantages. Among them, some are listed below. Like the basic requirements of smart healthcare is, so basic requirements is definitely minimize the delay in the continuous monitoring of the patient. Second is for the professionals, have a facility to go over the progress of the patient health and medications. So it is improved patient outcomes, where it comes improved drug management, decreased cost, improved diagnosis and treatment, improved disease management, remote monitoring of chronic disease. So these and enhance patient experience. You know, as a patient, what we require is our doctor should give time to us. but it is not possible on a part of the doctor. So if you are having something which can make you feel like that, yes, there is a continuous care being taken by someone regarding my disease, that itself gives a boost to improve the health of the patient. Okay, so these are the certain advantages. Disadvantages and challenges of IoT. Yes, each thing has got its advantages and disadvantages. Biggest challenge is security and privacy. Because you are accessing the data using the different devices, how much you can rely on the data which we have collected is really from the right device, from the right person. So that is a device level security has to be taken care of. Global regulation and mandates. Still all over the world, still we don't have a very defined regulations or mandates being made. When we talk about the automation, and specifically in India, still those things are not very clear. Okay, inadequate standardization. Yes, there is no standard policies. Cost of the devices. The device, there also people are working. Those who are working on the IoT device designing, they are working on that how without compromising on the efficiency of the device, the cost of the device can be reduced so that it can reach to the normal public. Okay, unauthorized access to centralization. This gives me a very good example, cost of the device. See, we are the generation which I belong. We have seen the phone where it was like from the finger, you used to dial the numbers. Okay. Till now we are able to see the smartphones. Phone in our time, the dial phone itself, if someone is having, it means the person was quite settled, financially strong person only used to keep it. The price of those phones are now so much reduced. It has the almost in every house, you will get at least one phone. I'm telling at least. Nowadays, I'm able to see even our maids who are coming in their house also, each person is having the mobile. Why it has become visible? Because the cost of the device has reduced. Same thing, the people have to work that on IoT devices, the cost need to be reduced, because unless the data collection is the cost is reduced, talking about this facility is of no use. Okay, unauthorized access to the centralization. Yes, because the data is getting collected to a centralized place, we should guarantee that these data are not taken up by someone who is not authorized to use it. Connectivity and power dependence. Yes, there the communication peoples come into the picture. There should be a continuous, because we are depending on the cloud, we are depending on the internet service. There should be a proper connectivity and the power dependence should be reduced. Expensive to implement, errors in patient data handling. Yes, if a small mistake is being done in any part of this one, it is the thing, the life of the patient we can lose. Okay, so these are the challenges of IOMT. Data overload on healthcare facility. Yes, this is another challenge, that a huge amount of data is coming. Maybe all data are not worth using. Then data integrity, that whatever data we are getting, how reliable those data are there. So these are the challenges of the IOMT, security and privacy. healthcare reform and mandates, technology adoption. And another biggest challenge is how forward the medical community is coming to adopt this technology. Why? Because still there is the resistance in using the technology in the hospital setup. So that is also a big challenge. IoT applications, remote patient monitoring, we have already seen is glucose monitoring, Parkinson's disease monitoring, ingestible sensors, robotic surgery, connected inhalers, heart rate monitoring, hand hygiene monitoring. From the time of the COVID, this has become a very good application, and devices have come to take all these things. Okay. So IMT adoption trends and influential factors. So when we talk about it, so if you can see the adoption of IOMT is this blue one, healthcare organizations worldwide that have already implemented IOMT to some extent. Orange one, that is 27% healthcare organizations worldwide that are planning to implement IOMT in future. And 13% still are there. They are healthcare organizations that haven't decided on IOMT yet. So this is one of the informations I have taken it from the net. Okay. So factors that contribute to the growth of IOMT popularity is the growing need for remote patient monitoring, high healthcare costs. Yes, as I told, healthcare costs depends on many factors. The increased consumer health awareness. So this is the reason why the IoT is in demand in the healthcare. So maybe this is my last slide. For the summary, what we can say is enhanced patient care can be given, operational efficiency will be there, cost reduction will be there. And what is the call of to action? Explore IoT solution, investigate IoT technologies and their potential benefit for healthcare settings. This is where the research are open. Consider implementation, evaluate how integrating IoT can improve patient care, operational efficiency and cost management. So finally, we can conclude that Internet of Medical Things, IOMT, it's a revolutionary transformation in healthcare industry. Okay. So with this, I'll open it for the questions. Any questions from any of the participants? Because see, just me telling will have no significance unless and until there is an interaction among us. So that's the reason I kept some time for the interaction. So if anyone.
I have one question.
Yes, please.
Ma'am, in IOMT, the security is the most crucial factor as well as it is the challenging aspect.
Yes, ma'am. Please repeat, ma'am.
In
Please repeat your question.
Madam, security is the most crucial as well as challenging aspect. Madam, is there any way available by which we can achieve the trustworthiness of the patient so that they can go for using these IoT devices in medical field?
See, that's it is not that IoT is not being used in the medical setup. It is being used. That's the reason the last slide which I showed, that nearly more than 60% of hospital setups are using it. Okay. But still there is an open research still in certain setups, and each hospital setups have got their own challenges, own issues. So you cannot generalize whatever is being used in one hospital setup, the same thing as it is can be used in the another one. So it has to be tested. If you remember during the COVID, it was being told that the vaccines are in the trial phase. Have you heard about it? Yes. So what does the trial means? Trial means maybe, see, and patients of each regions have got their own features. So similarly, when we are developing some AI model, few of the hospitals which I was showing you the statistics, more than 60% have already adopted. So it's not that as it is the same device in same setup can be used in the Bhubaneswar hospitals also. Because Bhubaneswar hospital has got certain more maybe extra things or certain more requirements of it. So it needs a fine tuning. So that can be done by the trial. Okay, so it's not that the things are not being developed, but it has to be tested. Was I able to answer your query?
Yes, ma'am. Yes, ma'am. From human, it's the human mind which cannot able to trust the machine 100%. That's why my question is that being a human, can I able to rely on this machine?
Let me ask you one more question. Question to your question. As a human being, can you trust another human being 100%?
Not 100%, but madam, somehow we can trust somehow. But machine
Is it not that the machines or no? Who is training these machines? Tell me. When we talk about machine learning models, it is we only are training. Yes? And how do we train? We train it from our own data. See, when we talk about any model in the healthcare, the data which is being collected, that is the reason it is very important to understand the data which you are using to train your model. Is it authenticate data or not? If it is really a clean, authenticate, standard data, your machine will be efficient, and it is always told a machine learning model cannot be 100% perfect. Reason is because as a human being also, we are not 100% efficient. How we can, with our own data, we can design a machine which can be 100%. So when we talk about this chat GPT, LLM models, you can't blindly rely on LLMs. But yes, you can take them as your assist. So I told you the pyramid when I showed you, as a machine learning, we will analyze it. We are assisting the doctors, but final decision has to be taken by the doctors. You can't replace the doctors. That is the biggest thing. You can't replace. But yes, you can be a helping hand to them. Why we require, how this chat GPT is helping us? You know, even I use it. Because it is giving me some idea. It doesn't mean without exploring, because chat GPT doesn't say, I am providing you the facts. It never claims that it is providing you the truth. It only do some work, and from the data available, it provides you some information. As a human being, as a domain expert, it becomes our responsibility to check how much truth is there in whatever the information has been provided with the machine. So machine learning models, all these automations are just an assist to the human being. They can't replace the human being. Hope I am clear.
Yes, ma'am. My answer is, I got my answer.
Yes.
The thing is that the doctor can never be replaced, and the machines are going to be assisting hand to the doctor.
Yes. See, because doctors are also human beings. They also get tired. Is it not? We think that they should see all the 100 patients with the same patience. Is it possible as a human being? No. And you know, among the 100 patients, hardly there will be 5 or 6 patients
whose case are very serious, who needs actual time of doctor. For rest all, if you will go to any allopathy medicine related doctor, they hardly give you any time. They simply write the prescription, which gives us a level of dissatisfaction that the doctor has even not touched me. But we do not understand that he is a human being. He has to see 100 patients, and his model is so much trained that just by querying you one or two things, they understand, yes, this medicine will help you. But let the serious patient go, and you will observe, doctor will give time to the patient. So see, what machines are trying to do is, they are trying to give the doctors, see, these are the serious patients, they really need your time, more of time. Others, I'm giving you some initial thing, just have a look to it and help them to get the treatment. And that happens even when you go to the hospitals. Junior doctor is there, they will collect the data, they will write certain things, and the senior doctor will just see what they have written. Accordingly, one or two questions they will ask and they will give you the prescription. Is it not that is happening? Why? So that is where the machines want to assist.
Yeah. Thank you so much, ma'am.
Yeah.
Is there any participant who wants to ask any query to ma'am? Any participant, any query, write it down on the chat box.
No questions?
Oh, ma'am, there is no
Okay.
query.
So hope I was very clear. I should be happy by that. As a teacher, we need the feedback. Okay, if you are not asking question, there may be two cases. One is you have just, as it is a remote work, you are not sitting in a classroom. So maybe either you have just logged in, or the another thing is I was very clear to you people to give my views.
You are very clear, but still one query is there for you in the chat box.
Is it? There is, someone has raised the hand also. I'm not able to see any query in the chat box.
A query is, will it be practically possible to implement the IoT in multi-speciality hospitals?
Yes, they are using it. They are using. That's the reason what I showed you in the slide. In the slide, if you see, this is what I gave you. 60% healthcare organizations worldwide, this is a healthcare IT news. 60% hospitals are using the IOMT. 27% have planned to use it. And remaining 13% totally they have not decided on. So it's not that the IOMT is just on the research. It is now being used. Any research, if it is not coming to a business model, it will never grow. It will only grow if you are able to transform it to the real world. Okay? So yes, people are using it. Anything else? One person raised hand. Can you unmute them? Or should they write in the chat box?
Let me check. Let me check, ma'am, who has raised the hand. Madam, the same person has asked the question in the chat.
Okay. So hope I have answered.
Yes, ma'am. Yes, ma'am.
Yeah.
Ma'am, thank you so very much for such an enlightening and inspiring session. Your talk was really very insightful, ma'am. That gave us a very deeper understanding of many concepts like IOMT, body area sensor network, importance of IOMT security, including the advantages and challenges of IOMT. Thank you so very much, ma'am.
Thank you.
Ma'am, we are very
Should I leave
delighted.
now?
No, ma'am.
Okay. Yeah.
Ma'am, you We are very much delighted to have you with us. Thank you, ma'am.
Thank you. Thank you. Thanks a lot. Thank you.
Thank you, ma'am.
Good night.
Good night, ma'am.
Good night.
you.